Welcome back to the program. We recently had the opportunity to visit veterinary neurologist Stephen Hansen in his office because Susie, our aging Ridgeback mix, seemed to be getting weakness in her hind legs. Now, fortunately, Susie's doing okay for a senior dog, but this got me and Peter talking about neurological problems that can occur in our companion animals. So what do you think might be the most common medical problems or diseases a veterinary neurologist sees? I want to welcome to the show veterinary neurologist Dr. Stephen Hansen. Hi, Dr. Hansen.
Hi. Thanks for having me.
You're welcome. Stephen, can you first tell us what is a veterinary neurologist?
Yeah, sure. So a veterinary neurologist is a veterinarian who, after veterinary school, does a specialty training residency. So it's generally 3 years of specialty training followed by board examinations. And through that process, one becomes board certified, a board certified specialist in neurological disease. Most veterinary neurologists are trained not only in medical neurology but also surgical neurology because the veterinary field does not have a neurosurgery specialty like the human medical field.
Right.
So most board-certified veterinary neurologists treat neurologic conditions such as seizures and balance problems and also perform spinal surgeries, sometimes intracranial surgery.
Wow. So what are the most common problems a veterinary neurologist treats?
Yeah, of the things that we see, by far the most common conditions are disc disease and seizures. Disc disease is a very common condition that doesn't always require evaluation by a neurologist, but it is a common disorder.
How is this diagnosed, and what are some of the symptoms?
Well, the first thing to look for is weakness or pain, because what's happening with disc disease is that one of the little cushions or intervertebral discs between the vertebrae of the spine undergoes degeneration. And when it degenerates, one of a couple of things can happen. Sometimes it just slowly bulges up and it pinches the spinal cord, which can cause weakness and pain. Or in other cases, a disc can very suddenly rupture where it impacts on the spinal cord and causes sudden paralysis, either of just the back legs or all four legs.
Is it difficult to distinguish between disc disease and, say, arthritis or dysplasia of the hips?
There's some overlap in the symptoms because both of those things can cause symptoms such as difficulty rising, difficulty going up and down stairs. But there's certain particular things that we look for in a neurologic examination to see if there is an actual neurologic impairment. Once we're suspicious of that, we'll oftentimes do tests such as X-rays or MRI to actually make the diagnosis.
Which dogs and cats get intervertebral disc disease? I mean, are certain breeds more susceptible?
Any dog can get intervertebral disc disease. Generally, that acute rupture with the sudden paralysis occurs in younger dogs, generally smaller dogs, and especially the ones with longer backs. So Dachshunds, for instance, Pekingese, Shih Tzus, other dogs with short legs and long backs are predisposed to that sort of disc degeneration. The more chronic or gradually bulging disc problems we see more often in larger and older dogs.
And how about prior injury or specific activities? Does that cause disc disease?
Well, sometimes certain discs can protrude just from wear and tear. So sometimes with larger dogs that do a lot of running around over years, their disc will kind of experience wear and tear and start to bulge. With the little dogs with the sudden disc rupture, that's a condition that can start to smolder without any symptoms whatsoever, and then the disc becomes like a time bomb. And one day the dog may jump off the couch or maybe running around the house, or it may just be walking across the kitchen floor, and suddenly that disc can rupture. So it doesn't take any sort of trauma or any activity out of the ordinary to set that disc rupture off.
Can we prevent this, Dr. Hansen?
Generally not. Dogs have a genetic propensity to develop this disease, and like I mentioned, things like jumping can kind of put the disc over the edge and actually cause the rupture. But that rupture can certainly occur even if a dog never jumps or goes up and down the stairs. So basically, there's not much that can be done to prevent it. In the small dogs, I like to not encourage them to do things that involve jumping. So we have to let a dog be a dog, and they have to run around and play. But I like to have people avoid actually enticing their dog to jump up and greet them, or jump on their back legs, which would put their spine in more of a upright position and put more stress on the discs.
Right. What's your approach to treating intravertebral disc disease?
Well, in a lot of cases, it only takes medication. So sometimes we'll use anti-inflammatory medications or pain medications, and those things are especially helpful in the short term. So sometimes a disc will have kind of a flare-up, and we need to give medication for a couple of weeks, and then the inflammation subsides and we can get them off of medication. Sometimes when longer-term therapy is needed, we also use acupuncture, which seems to be good in helping with pain control and sometimes allowing us to get by with less of the pharmaceuticals. When the disease is severe enough, though, it requires surgery, and especially a dog who is paralyzed from a disc rupture. That's actually an emergency. So if a dog were to be suddenly paralyzed, it's essential that it gets to a veterinarian right away, and then probably referred to a specialist and get the testing and surgery done. The good news about that is most dogs that are paralyzed from a ruptured disc eventually walk. And so with timely treatment, the prognosis is quite good.
Do cats get disc disease?
They do, but a lot less commonly.
Yeah.
So I would say for every couple hundred dogs that we see with a disc rupture, we might see a cat with a disc problem.
Thank you very much, veterinary neurologist Dr. Stephen Hansen. I'm sorry we didn't get a chance to talk about seizures. We'll definitely talk about that on an upcoming show. Thanks again.
My pleasure.